Hello, my dear friends. I once again welcome you to this session of Corona COVID, in which we will discuss about an important aspect, that is a cytokine storm. What is a cytokine storm? What are its implications? Cytokine storm is commonly used today in medical field. Even ordinary people are also using cytokine storm. He or she or somebody died because of the cytokine storm. So this is what we hear today. Doctors say the deaths in the COVID, majority are due to cytokine storm, multiple organ failure. These are the reasons for deaths of the COVID patients. The reason behind this is the corona storm. What is storm? We know. Storm is a violent, forcible wind associated with rain, thunderstorm, lightning, sometimes with snow. This is the meaning in meteorology. The storm is here also it is used with the same meaning. It is a violent, forcible, damaging, and deadly due to cytokines. Now let us try to understand what are cytokines, what is their diversity, how do they function, what is cytokine storm. These aspects let us try to understand. Cytokines are low molecular weight compounds less than 30 kilodaltons, which belong to proteins or glycoproteins. Carbohydrates associated with proteins are called glycoproteins, secreted by immune cells, just like monocyte, macrophage, T lymphocyte, B lymphocyte, nature killing cells, and various other cells, not only immune cells, but various other cells like endotheliocytes, epithelial cells, fibroblasts, or people say any nucleated cell in the body in response to number of stimuli. The body cells, the body organs, tissues are stimulated by a number of external factors, just like pathogens, virus, bacteria, physical injuries, or sometimes other things. These proteins, cytokine proteins, assist in regulating the development of effector cells. When there is a disease, when there is an injury, an effect will be brought about that will be regulated by the cytokines. Cytokines are very large number, diverse family. Chemically they are diverse, functionally they are diverse, of small proteins less than 30 kilodaltons. Cytokines are signaling molecules. They carry the message from one cell to another cell inside the body. Signaling molecules. If signal is there, it is carried through the cytokinins from one cell to another cell, or sometimes one tissue to another tissue. they help in cell communication in immune responses. When there is an immune response to the stimulus, injury, infection, they bring about the communication between the cells, between the tissues, and stimulate the movement of cells towards the sites of inflammation. They carry the signals and bring about a function in such a way that the protective cells, immune cells, are directed towards the site of inflammation, that is site of infection and trauma. So these are the cytokines, chemicals, proteins or glycoproteins, small molecular weight proteins, divers, produced by number of cells, macrophages, granulocytes, fibroblasts, endothelial cells, mast cells, lymphocytes, and some other cells. That means they are produced by a large number of different cells. So therefore, naturally, chemically, they will be different. Functionally, they will be different cytokines. Functional diversity. There is chemical diversity as well as functional diversity. Origin-wise also diversity. They are produced from different cells. So these are different types of cytokines which are broadly divided into families based upon their chemical nature. These are the functions. Interferon family, mostly antiviral proteins. Whenever there is viral infection, these are produced interferons. Interferons also belong to cytokine. Cytokine family, direct cell migration from healthy tissues to the infection site. Adhesion, activation, contribute embryogenesis in normal organisms. They contribute embryogenesis for normal development also cytokines are required. The development of the innate immune response systems. As the baby, as the fetus develops, the innate immune system develops. Similarly, adaptive. For these, the chemokine family is necessary, and cancer metastasis. Tumor and necrosis factor regulate inflammatory and immune response. TNF, tumor necrosis factor family, inflammation, infection site where there is inflammation, regulates and immune response. Interleukin family, a variety of functions, variety of interleukins, IL-6, IL-1, IL-2, IL-3, like that, depend upon the interleukin and cell type. The function depends upon the interleukin and cell type. Hematopoietins protect cell, promote cell proliferation and differentiation. Transforming growth factors, beta family, regulation of immune cells. So here what we must understand, cytokinins are produced not only when there is an infection, they are required for normal development of the organism, normal development of the body. Just like, for example, here you see the variety of function, promote cell proliferation, regulation immune cells, then embryogenesis. A variety of normal functions, but they are required. Cytokinins exhibit attributes of pleiotropy, redundancy, synergy, antagonism, and cascade induction. Pleiotropy means a single cytokine may act upon different types of cells, bring about different types of responses. Synergy means two different types of cytokinins may act together and enhance the response activity. Antagonism, one cytokine may inhibit the function of another cytokine, antagonism. Then cascade induction means one cytokine induces or stimulates a cell. That cell in turn produces cytokines. Those cytokines go to another cell, induce the cytokine production. This is a cascade of reactions, one after the other. Given cytokine, all these I have explained. Then the action may occur in an autocrine. Autocrine means suppose a cytokine is produced by a cell. The cytokine in turn acts on the same cell, autocrine. Paracrine, a cytokine produced by a cell acts upon the neighboring cells close to it. Endocrine, a cytokine produced by a cell migrates through the blood, goes to a different part. There it reaches the target cell, far away from the origin. Receptor engagement triggers intracellular signaling cascades. The cytokines produced by cells, they go to the effector cells and bring about a cascade of reactions, cascade of events, which leads to biological effect. Differentiation, proliferation, activation of target cell or effects of cytokine. Differentiation if necessary, proliferation and active proliferation usually in case of cancers, and activation of target cell. The cytokines reach a particular cell, there will be a receptor and there will be interaction between the cytokine and receptor. There it triggers a mechanism in the target cell, protective mechanism. Cytokines mainly with respect to infections regulate immune response. Cascade induction, as I told you, one after the other. Cytokine produced by one cell goes to another cell, activates that cell, that second cell produces cytokines. The cytokine is produced by the second cell, activate the third cell, that cell also produces the cytokines. This will go a cascade of induction. Activate vascular epithelium. Immunopathologically, these cytokines activate vascular innermost layer of the blood capillaries. Activate lymphocytes, T lymphocytes. Activate nature killer cells. Neutralization, NK cells. Induce fever and shock. Induce the differentiation of T cells into TH cells. These are the functions of a typical cytokines in case of infections. Now, this is how the cytokines function. Stimulus. That stimulus may be hypoxia, less oxygen. Injury, any physical injury, or inflammation due to infection, virus or bacterial. Stimulus. This stimulus activates the cytokine producing cells. Now, earlier we have seen what are the cytokine producing cells. These are cytokines, chemicals, proteins, glycoproteins, small molecular weight. These cytokines go to the target cell. On the surface of the target cell, there will be a receptor, a close interaction, compatibility between the cytokine and the receptor. Then only this will be activated. If there is no compatibility between the cytokine and the receptor, this is not activated. Then inside the cell, again, there will be a cascade of intracellular communications. A message will be sent to the DNA through some factors, and the DNA in turn is activated to produce the new proteins, and thus it brings about biological effect. Stimulation, release of cytokines, then binding to specific receptors on the target cell, and cell activation. This is activation. What is inflammation? Here it is important to know what is inflammation. For general public, inflammation, people think that it is swelling. Is a process by which our body blood cells and the things they make, blood cells and the chemicals produced by the WBC, white blood cells, protect us from infection from outside invaders such as bacteria and viruses. It is inflammation is a protective mechanism of immune system. White blood cells are part of the immune system. They themselves or the chemicals produced by them or rush to the infection site. Symptoms of inflammation include redness at the site of infection, swelling, warmth. These are in autoimmune disease, joint pain, joint stiffness, and here autoimmune disease is just like rheumatitis. When inflammation happens, chemicals from white blood cells enter into blood or tissues to protect our body from invaders. When there is an infection, white blood cells and their chemicals rush through the blood. They rush to the site of they raise the blood flow to the area of injury or infection. It can cause redness, swelling, warmth. Some of the chemicals cause fluid to leak into the tissues, resulting in swelling. When there is an infection, usually there will be a swelling. Swelling is because of the release of chemicals at that particular tissue. The protective tissue may serve, they cause pain because there will be a number of chemical reactions. The nerves become activated. As a result of there will be a pain. What is cytokine storm? Now, at this juncture, it is proper to understand cytokine storm. Overproduction of cytokines. But there is no correct definition. Broadly speaking, hyperactive immune response. In fact, immune response should be there. It should be normal as much as required. As much as required. But here, hyperactive immune response characterized by the release of interferons, all these interleukins, necrosis factors, chemokines, and others, all these together known as cytokines. These mediators are part of a well-conserved immune response. Cytokines are not new. They are the part of inbuilt, innate system. Innate system will be there since the beginning. It is cytokine production is a part of innate immune response necessary for efficient clearance of during cytokine storm. Various inflammatory cytokines are produced at much higher rate than normal. The cytokines which are involved in inflammation are produced at faster rate, enormous number than what is required. The overproduction of cytokines positive feedback on other immune cells. So this is a positive feedback. When immune cytokinins are produced, they go to the other cells, induce them, they make the produce cells again the new cytokines. This cascade of reactions will in fact flood the tissue, flood the system with cytokines. Overproduction, hyperimmunity response, more immune cells to be recruited to the site of injury and can lead to organ, and if the cytokines are produced at normal levels, there is no problem. In fact, it is required. But if they are produced more than required, 30 times, 40 times, sometimes more in number, that will be damaging the tissue at the site of injury, even in other parts also, that lead to organ and tissue damage. Levels of cytokines injurious to the host cell. So immune system responds in a violent way, very dangerous way. It should in fact normally respond. That is what is required. But here overproduction, overreaction, that is injurious, damaging to the cell, has been reported in a number of diseases and autoimmune diseases. This cytokine storm not only reported in COVID, it is not a new one. It has been reported in autoimmune diseases like rheumatitis. It is also reported some infectious diseases in case of viral infections like H5N1 virus, influenza H1N1, and other coronavirus, COVID-19, SARS coronavirus, and MERS, Middle East respiratory syndrome coronavirus. In these cases also, cytokine storm was reported. In case of COVID-19, CO2-19, lung injury is one of consequence of cytokine storm. If cytokine storm sets in, the immediate effect is lung injury that can progress into acute lung injury or its more severe form of ARDS, acute respiratory disease syndrome. If cytokine is more, lungs are injured. If the lungs are injured, the respiratory problems, acute respiratory problem. Now, this is cytokine storm, mild infection, corona, COVID. Cytokinin levels are normal, low. If it progresses to moderate infection, cytokine produced, but limiting level, not injurious. But if the disease progresses to severity, then cytokines are produced in large numbers, what we call cytokine storm. So this is how the cytokine levels are increasing as the disease progresses from mild to severity. Cytokine levels increase. So this is how stages and result of cytokine storm. COVID-19 virus infects alveoli of lungs, the innermost tissue cells of the lungs. Inflammatory signals, a signal will be generated that there is a danger, there is an infection. So that is the beauty of the immune system. The inflammatory signals go to cytokine producing cells. A large number of cells are there, as we have seen. These cells produce the cytokines not at normal level, but at higher level, just like a storm. very higher level, hyperproductivity. This cytokine storm result is ARD, acute respiratory disease syndrome, multiple organ failure, hyperinflammation, death, then cytokine release syndrome, together known as cytokine release syndrome. When cytokines are released in large numbers, and that syndrome will be called cytokine, which includes ARDS, multiple organ failure, hyperinflammation, death. So here, lot of immunopathology is involved. I am not going into the details, but the cytokines overproduction leads to these effects, together known as cytokine release syndrome. Cytokine storm results from a sudden acute increase in circulating levels of the different pro-inflammatory, which enhance the inflammation, including IL-6, IL-1, TNF, alpha, and interferons. So this is the result. All the cells are recruited, go to the infection site, from the circulating into the site of infection with a destructive effect. Here, whenever there is large number, so that is destructive effects include destabilization of endothelial cells, damage of vascular barrier, capillary damage, diffuse orvalular damage, multi-organ failure, and ultimately death. Cytokine storm appears to be one of the common causes of mortality, death, in the recently declared pandemic of COVID-19. Many of the patients die because of the cytokine storm that will have a lot of effect, particularly multiple organ failure. In the absence of immediate and appropriate therapeutic intervention, when there is cytokine storm, appropriate treatment should be taken up. Otherwise, the patients develop ARDS as a result of acute lung damage followed by multi-organ failure resulting in death. Lung infection, and that because lung infection crucial organs for oxygen, and that will be having effect on other organs. Then how to diagnose the cytokine storm? Presently, three methods are available: biomarkers, estimation of plasma ferritin, C-reactive protein, CRP, estimation of interleukin 6. By estimating this, the doctors decide whether there is cytokine storm or not. So naturally there will be elevated levels of all these three: ferritin, CRP, and IL-6. Then how to manage? How do the doctors manage? I'm not going to the details, but one aspect is early detection of cytokine storm. If cytokine storm is detected early, one can interfere with that storm production and subsequent effects. The treatments include inhibition of all these part of cytokines: IL-1, 6, TNF, IFN, alpha, gamma, JK pathway. Then inhibiting these, that means decreasing, not allowing the cytokine storm. Second, anti-inflammatory immunosuppressive agents. Cytokines, if produced in large numbers, they can be removed by blood purification, one system. The blood can be purified and remove the cytokine. Application of therapeutic plasma exchange in the treatment of cytokine storm, or we can use plasma transfusion, plasma treatment. From healthy persons, plasma can be taken, or recovered persons, the plasma can be taken. So it contains the antibodies, and they will neutralize the IL-6 like factors. Cytokine inhibitors include tocilizumab, anakinra, and all these chemicals are available, cytokine inhibitors. Most useful, tocilizumab, a monoclonal antibody, is a humanized immunoglobulin IgG-IK anti-human IL-6 or MAB monoclonal antibody approved by treatment. It inhibits the IL-6. The main problem with the IL-6, it inhibits the IL-6. It goes and binds to this IL-6 and neutralizes. Then, an effective treatment for severe or life-threatening cytokine release syndrome. So, presently, this treatment is allowed. It is approved for the treatment. It will substantially decrease the levels of IL-6 and protect the patient from the subsequent pathological, immunopathological effects. Thank you very much for giving your valuable time.